I'm Eric Humphreys. I'm a retired anesthesiologist. Sometimes it would be all that I could do to make it through the day as far as discomfort was concerned, and then would literally go home and get off my feet and sometimes sit for hours. I'm somewhat irritable anyway by nature. That would only make it worse, like an old dog licking its wounds. I best left alone, or I might snarl or growl at somebody, and it kept me from doing the type of exercise that I wanted to do, and eventually got to the point where even vacations and social activities became a problem. My son was a pretty good high school level soccer player. I missed some of his matches because just walking from a parking lot and climbing the stairs at a stadium were problematic. But it wasn't long after I retired that I got in contact with Dr. Politi and said, you know, he and his partners had told me years ago, you need to have your knees replaced. There's nothing else that's going to relieve what you're experiencing. He said, well, I think we can take care of you as an outpatient because you're young and healthy. And I said, young and healthy? Okay.
So what used to be a surgery where you needed to stay in the hospital for a week has evolved into, we do this surgery routinely and send people home the next day. We're trying to create a better patient experience from the beginning, and that means a more efficient recovery, a quicker return to normal living. This facility was designed specifically for outpatient surgeries, and so the flow of patients in and out is set up so that it happens in a way that is very natural, and the patients can move right along.
I was in the operating room actually before the time of my surgery, which was approximately 7 a.m. and I had recovered from general anesthetic and was stable enough on a walker that I was discharged at 11:45 that same morning. Was in my own home, in my own chair, enjoying television within an hour of having left the facility. There were a lot of advantages to being at home rather than being at the hospital. The physical therapist and the nurse came the next day to check on me. She wanted to make sure that I was able to get up, use the walker properly, that I was able to get in and out of the facilities without any difficulties, and that was very nice.
We all know that the people make the place, right? And so when we designed and built and opened this facility, a major emphasis was placed on putting the right people. And luckily, we had a lot of great caregivers who wanted to come and work here. They care about the patients, they care about the process, they're very invested in the quality of care, and it shows.
Since the knee replacements, I am working out much more effectively at the gym. I've actually strengthened my legs. I have gained muscle mass in my quadriceps. I can walk longer distances with minimal discomfort. My wife has been incredibly excited. Her biggest joy is that now I'm able to go out and do as much yard work as she needs me to do without complaining that I'm tired or my knees hurt. If your physician feels that you're a candidate for an outpatient procedure, this is definitely a fantastic place to come, and I would not hesitate to send a family member here.